we're going to have a presentation on healthy living and heart health. So I want to crave your indulgence to introduce our special visitors today. The leader of the team is someone who, if I decide to reel out all his qualifications, we might not finish it tomorrow. So I have to cut it short, okay? And so the leader of the team is Dr. Nwakoby Yanagawa. He is the division head of cardiac surgery, St. Michael's Hospital, as well as the program director, division of cardiac surgery, University of Toronto. So, and working under him is a 40-year medical student. 40-year medical student, Akachukwu Nwakoby. Akachukwu happens to be my son. Hold on. So when you see me the buga, you know why I'm the buga. Yes, it's my son that I'm well pleased with. So, the second medical student unfortunately couldn't make it due to medical reasons. So he fell sick, so he couldn't come. But all the same, his spirit is here with us today. Okay? So I would like to call on Dr. Yanagawa. Dr. Yanagawa, first of all, these are the members of Igbo Union. We are more than this, but these are the ones that were able to come today. Okay? So we are from the southeastern part of Nigeria. Very enterprising young people and very interested in medical field. Most of us here are doctors and nurses. Actually, I want to recognize one doctor in our midst, Dr. Valerie Mbatog, who is the wife of Dr. Sam Mbatog. There's another doctor that is not here today. I will call him Okaka, but it's Dr. Anastasius, who is another doctor, and we have others too. You are not a doctor. Yeah. So let us please put our hands together to welcome Dr. I will dim the light.
Listen, it's Sunday evening, so we don't want to go into nauseating detail, but I want to give you a brief overview of some things that we're doing at University of Toronto with Aka, and a brief overview of heart health, something that's very near and dear to my heart. And it's a great pleasure to be at the Igbo Community Center. I'm a huge fan of the Nigerian fighters, because I'm a boxer myself. And I don't know, Anthony Joshua, and in fact I was in New York when Anthony Joshua was fighting in the garden, and a great history of fighters and great history of people. So thank you for having me here. Let's go to the next slide. So the heart, the heart has been very special to human beings. For all of time, the Egyptians felt like when a man or a woman dies, the heart is weighed against the feather. In the heart is all the good and the bad things that a person does, and based on how people live their life, they either go to the underworld or heaven. So we've always thought the heart is a very special organ in every culture. Next slide. And next slide. Keep going. That's right. Many, many ways that people can get sick or die. But the heart, cardiovascular disease, is one of the top. Why is that? Why we have a heart? It must beat every single moment. It's so critical to our survival. Why does it fail so much? Why does everyone get heart disease and valvular disease and dissection? Let's have an understanding of this. Next slide. Right. Okay, next slide. Maybe this gentleman has a key. We have to look at the past. Just hit the next slide there. Right? Sometimes the answers to the human civilization, human biology, live in the past. For much of human civilization, we were hunter-gatherers. Only 20,000 years ago, we had the agricultural revolution. What kind of things did we eat? Meats, not much breads and this and sugar and that. That's the type of diet we had. We were hunter-gatherers, always exercising, fasting. And so this is the type of life that we're supposed to live. Our bodies are adapted to live in this life, not McDonald's life, right? This is a new life. So let's think about it. What were the things that would kill this person? Starvation, just click the next thing, right? So how do we prevent starvation from happening? We store fat. Fat is critical. We think of fat as bad. People are fat, it's not healthy. But no, fat is critical for life. If we cannot store fat and energy, we die. So fat is important for us, and our bodies are able to store fat. Too much, of course, is not so good. Infectious disease. Now we have all of these immune diseases. Innate adaptive immune diseases that we never had before. Rheumatoid arthritis and chronic immune. But immune response is protective. Protects us from foreign invaders like bacteria and viruses. Next one. And for the hunter-gatherer, traumatic injury was a great source of death. A saber-toothed tiger rips off your arm. You don't want to bleed to death, so you clot the blood. But now the clotting of the blood is causing stroke and heart disease. You clot too much. So these are not bad responses. These are good responses for another era. And we have to think when we live our lives about how we should live, maybe closer to how we used to live when pre-agricultural revolution. Next slide. Now I just want to switch gears a little bit, okay? What is heart surgery? What does that mean, heart surgery? Next slide. So we as heart surgeons, there's about 300 in the country, only 300 for a population of 35 million people. But we do 500,000 operations a year worldwide and 30,000 operations a year in Canada. I myself do about 250 operations each year. Next slide. The most common surgery that we do is a surgery I'm sure that you heard of and your friends or some people you've known have had is bypass surgery. Okay? Coronary artery bypass. Why? Because the heart is like an engine, and sometimes the pipes in the engine get blocked because we have calcium accumulation, fat accumulation, type 2 diabetes, smoking, blockages, and we have to put new pipes in the engine. Okay? But sometimes we do other surgery. This is a fellow that we did. This is a fellow who had a spear or a, what do you call it, bow and arrow stuck into his heart. So sometimes we do these type of surgeries. Pull out the thing, rescue the patient. So our lives are kind of high intensity surgery. Next slide. We work as a team. Of course, when I look at this community center, you're working as a team, a group, a community, support each other. This is a beautiful team right here. We work with nurses, anesthesia, family doctors, cardiologists, etc. We all work together for the patient's sake. Next slide. This is our team. I'm a surgeon here. I have an assistant. I have assistant here, nurses, anesthesia. Many people work together as one to perform something at high intensity as heart surgery. Next slide. Teamwork makes the dream. Okay, so our goal, what do I come here for? One is to get to know you a little bit, it's my pleasure. But the other is to just give you some ideas about how you can stay out of my operating room. I love to operate. I would love to operate on you. But my goal is to have you not have an operation. Next one. So these are the things, and you know all of these, or may know most of them, that cause heart disease. Okay? Diabetes. That's high sugar intake. And lots of obesity. Smoking. Of course, smoking is a modifiable risk factor. It's something that we can change. High blood pressure. Our genetics, listen, we can't choose our mothers and fathers. So we have our genetics, cannot change it. That's okay. Obesity and high cholesterol. But some of these ones we can definitely change. Next one. Okay, we'll talk about obesity. Listen, in every part of the country, every part of the world, every community. This is Beijing, 1986. Look at everyone, all the bicycles, everyone exercising, everyone's so slim, right? Look at Beijing now. Okay? Now China is rich. Okay? Everyone's driving, eating McDonald's, eating steaks, and everyone's in cars. And in China, a country of 1.5 5 billion people, obesity rates are rising. So we see this everywhere, right? Let's go over here, next one. This is Lagos traffic 2023. Okay, we have some people walking, but we have a lot of cars, right? Nigeria is getting rich. Coming into Western civilization, we eat high-fat diet, and we're a little bit more sedentary than we used to be. Okay? We have to work on this. If we look at countries such as Nigeria, others in sub-Saharan Africa, and other parts of Asia, we see, next slide, as the country gets richer, of course, infectious disease is less, but not gone. But now we have non-communicable diseases, stroke, cancer, heart attack. These are the diseases that we see start to rise. So we have to change our thinking a little bit. Next one. So metabolic syndrome. So one of the things that we have to do is exercise. I operate on many, many patients. I say, okay, sir, you're a 50-year-old gentleman. What do you do for exercise? They say, maybe I walk half an hour, 20 minutes a day. I said, that's not enough. We have to be running, we have to exercise, do something that we enjoy doing, tennis, whatever it is. We have to get out and get active. Next one. Okay. And next one. Okay, I'll tell you a little bit about eating. Now, each country, each society, each community has different types of diets. Most of them are very healthy, balanced. Carbohydrate, protein, and vegetables, and fish, right? I'll tell you, when we do experiments in animals and we look at humans, there's one way that we can consistently have people live longer, or animals live longer, and that's caloric restriction. Next slide. So this is a complex slide, and I don't want to go through it in great detail, but as you go from green to blue to yellow to red, we're restricting the diets of mice. Next slide. And as we go there, as we do that, the less calories that people eat, the longer they live. That has consistently been shown. So that's in the animal experiments. In human experiments, a little bit different. Caloric restriction, important. Exercise, important. But the other thing, we look at green zones. There are green zones in the world. Okinawa Islands in Japan, the Mediterranean communities, some communities where people routinely live into their 90s and 100s. And one of the things is actually community connection. When people get old and lonely and isolated from their families and community, they become increasing depression and morbidity and mortality. So these type of, I love to see this kind of community, everyone supporting one another, because this makes people live longer. Next slide. Okay, and then next slide. So again, just keep going on this one. Caloric restriction reduces cancer, osteoporosis, neurological decline, autoimmunity, and on and on and on. So diet is very, very important. Of course, we love to eat. It's part of our culture as well, but we cannot eat, thousands and thousands and thousands of calories. It's not that healthy. So we have to think a little bit about sometimes restricting a little bit. Next slide. And if we say, well, what should we not eat? People say, don't eat steak, don't eat meat. My opinion is that vegetables, you can eat as much vegetables as you want, and you can eat as much meat as you want. Meat is very good. If you think about the hunter-gatherer, eat lots of meat, but carbohydrates, the candies, right? The sweets, the pastries, or the breads. This we have to decrease a little bit in order for us to be healthy. Let's go next slide. Smoking goes without saying. Now, I'm not sure, actually, I'm not educated on the rates of smoking in your community. But this is one thing that we have to teach our young people not to smoke. Right. Next slide. 2 to 6 times more likely to have a heart attack. And 1 year after you quit, very hard, but if you quit, your risk of heart disease drops more than 50%. So just because you smoke 20 years, you say there's no hope. That's not true. You still have a chance to turn things around. Next one. So the bottom line is exercise. Next one. Modest diet. Next one. And no smoking. If we can do these 3 things, we as a group can live healthier and longer lives if we can support each other to do these things. Next slide. And next slide. So in the Black community, actually, the rates of hypertension, high blood pressure, obesity, and diabetes are actually quite high. So, listen, some communities have breast cancer, some communities have prostate, and Japanese, in my community, we have lots of gastric cancer, stomach cancer. But in your community, maybe a little bit higher rates of high blood pressure and obesity. So something we have to work together on. And I'm happy to work with you, or Aka's going to work with you. He's one of your shining stars in the community. Next one. Okay. And then we're going to decrease the risk of all of these bad things. Next one. So, one of the things that we can offer is, I'm just a heart surgeon. I like to operate and I work with people like Aka. But, if you have some interest, you say, I would like to get a cardiac screening investigation or a referral or a consultation. We can help you to do that. And just go to the next slide. I have my email at the bottom, and we can offer this to you. Aka and his father and the group have my contact. So if there's anything that we can help you personally or professionally, we're happy to do so. Okay, next slide. So in the next 3 minutes, I just want to tell you a little bit about some things that I do in the terms of diversity. Okay, and diversity in heart surgery is very important. I believe in this very much, and one of the reasons why perhaps I'm here. Next slide. Next one. So despite what we said in, for example, black communities, higher atherosclerosis, higher hypertension, obesity, you would think that this population would actually undergo heart surgery and use cardiological services more often. But in fact, the opposite is true. Actually, it's less use of cardiac services. So why is that? I'm concerned that it's an issue of access. Zero. Maybe in this room we have the first one. Okay? And then we have more. Okay? So something we have to change. Okay? Let's go. I like this picture. Everyone know this picture? Right? It's in the Gambasa airport. They say at night there's no electricity. So the students go to the airport because there's light and they study all night. So there is talent and hunger and energy everywhere. Ambition, and we're not capturing it. So that's a shame, right? All for us, because we want the best, and we want this beautiful thing for heart surgery to be offered, to be available to anybody, to achieve their goals and their dream. Because this, I tell you, is a dream of mine. This job I have is my dream. Let's go next one. Okay. So I'm the director of the EDI task force. I'm tasked with getting more women into heart surgery, more minorities into heart surgery. I want to make it open for everybody. Okay? Let's go through this. We can go past this. It's complicated. So this is the group we have now. Okay, a little bit more diversity. Okay, we're working on it. We have more young ladies, and many of them are very, very good. They're better than the men, I tell you. Okay, they're tougher. They're tougher and better surgeons than the men. So we're changing things slowly, but we need to make more changes. Okay, next one. 2 years ago, we trained Dr. Mariam Al-Amir. She's going back to Saudi Arabia, for instance. She's going to be one of very few women who are heart surgeons in Saudi Arabia. Next one. I trained Dr. Bayan Al-Sheikh, also from Saudi Arabia. Just an example, She was able to operate on hearts before she could drive a car in the country, because women could not drive cars. So we're changing very fast, right? But we have work to do around the world. Next one. So we have programs, and you see a young Aka on the corner there. He was driving this program. We say, listen, if we want, I'd be honest and say we want more black and indigenous heart surgeons. But if we don't have black and indigenous medical student, it's impossible. So then we have to go earlier. So we did a program in the high school system. Next slide. And this was a pilot program we did 2 years ago, and this year it's going to be growing the program, and they got some excitement in the media, and we would love to have your support and encouragement, and if you have young folks that are interested in becoming doctors, then we would like to support them and support their dreams. What do we have? This is a young Ekane. He was supposed to be here, but he got sick. That's okay. Next time he'll be here. So we have a scholarship for him this year to do research in heart surgery labs. And then this is the next program over on the right that Aka he's leading the program. He's the director of the program. Even though he's young, he's developed this idea. He's a co-director with myself and a leader in the Toronto Community Housing Services. So we're going to change things. Not going to happen overnight, but we're changing things, I think, for the better. Next one. And that's it. That's all I wanted to say. Thank you for your attention. I hope this could be maybe a relationship. We can talk again. And this young man in the back, you should be very proud of him. He's working very hard. And sir, you raised a good man. You should be very, very proud of him. And we hope he's going to be one of the next great heart surgeons. Let's do questions.
Okay,
Yeah.
good. So thank you very much. Please, can we give him a standing ovation? So he's going to take a few questions because I know we have things that we want to kind of clarify based on the presentation or something that has been bothering you. So that's the time to do it. So if you want to ask a question, just raise your hand and then I would ask you to go ahead. Okay, Phil, go ahead.
First, I want to thank you for the excellent presentation. And we want to thank you for the service you offer to humanity. So, looking at the presentation, I looked at the causes of death. You say cancer is 29%, and heart disease is 27%. It's just 2% in proportion. But looking at the noise, the awareness about cancer death is up there in the roof.
Yeah.
But very little is known about heart death. So what are you and your team to bring? I mean, you brought it to us today. So what else are you guys doing to enlarge the awareness? Because from what you talked about what we can do, there's a whole lot that we can do to stay away from it. And I never wish to be on your team. Or anybody I know. Not that I don't want you to be in business. So there are simple things based on what you explained to us that we can do: exercising, dieting, and avoiding smoking. So there are basics. So bringing the awareness and letting people know that they stand a huge risk of dying from things they can't afford. That's what I want. What are you guys doing to increase awareness?
Thank you. That's a good question. So number one is cancer always gets a lot of attention because it's dramatic, right? 16-year-old child gets leukemia. Oh my! It's so tragic, right? Young children, women with breast cancer, young, live have a whole future and cut short by breast cancer. So it's so dramatic. Cardiovascular disease is also dramatic, but it typically happens in later stage of life, right? It's still important, right? 60-year-old fella, 65-year-old lady wants to live a full life, maybe life is cut short, but it's a little bit less dramatic. And they say, well, what happened to Roger? He was 70, he looked pretty healthy. He had a heart attack and died. Oh, okay, I guess so. But so the story is different. So we have some work to do. I mean, it's something I would ask you. What do we do? In our professional societies, governmental organizations, hospitals, we try to get the word out. We try to get campaigns, but maybe the campaign, the message is not reaching all the people. Maybe it's not reaching certain societies. So if there's something that we can do to get the word out, I would like to get your opinion or advice. This is one way, a small way, and we can do more of these things to educate. But I would like to hear your opinion. If the word is not reaching you, how can we do it better?
Okay, I was about to answer it. So this is Igbo community.
Yeah.
in Igbo community, we have different groups. We will have Igbo Catholics. I will look for the opportunity for you to do the same kind of presentation to Igbo Catholics. So
Absolutely.
we'll have to make the arrangements to ensure that that happens. So we'll liaise with he and the whether that is a member to get our attention. Thank you.
No, absolutely, thank you. Yes.
So, you said you're going to liaise with him and me. So I'm gradually getting into medical school. Okay, apparently. After apparently months and...
Thanks for coming. Harry made a point of exercising is one of the things to
Absolutely.
think. Why is that people, when they are doing exercise, they get into an attack and die?
So he's saying that why is it that Dr. Yanagawa said that exercise is good for the heart, but why is it that when people do exercise at times they fall and die? So,
Yeah. It's a good, very, very good question. So, it's a tough one. The benefit of exercise far outweighs the risk of exercise. So far outweighs the thousands and thousands and people that benefit from exercise. Far outweighs the risk of the 1-2 people. You maybe, if I may say, you may remember it because it's so dramatic. Oh my God, he was on the treadmill and had a heart attack trying to exercise. So the story is so, it sticks in your mind. It's like, oh, actually, exercise may be dangerous. But no, I don't think so. One is you have to listen to the body. Some people who never exercise, they suddenly go out, shovel the snow, getting chest pain, push through. Of course, we don't want to push anything. If you have to listen to your body, everything is start slowly, do more and more and more. But, to say exercise is dangerous, I would not think so. The other answer is, before you start exercise, if you're of a certain age or have some risk factors, just get a cardiac examination, get an investigation. Check, everything okay? I'm going. Now you're safe. So that would be a reasonable approach as well.
okay, please, we are going to take only 3 more, please, because we have one more presentation and time is going.
Yes.
Please, Eman and
this question is
they've been raising their hands since.
I'm a cancer patient.
Please make it fast.
Multiple myeloma.
Multiple, okay.
Yeah. And I've been having some heart problems. I have been to Yanagawa Hospital on several occasions to have problems. If I lift something very hard now, I start having shortness of breath and tension. What people see me, they think I'm normal. However, a friend of mine in Europe, at the first thing of this morning, he went, they gave him the gadgets, which he put for some days, and returned it. After that, he told him not to do any exercise again, that his heart could drop any moment, and he dies. In this case, I don't know. I've been checking myself. Among the medications I take is Xarelto and Bicepro, yeah, for my heart. I don't know. For some people who are in my condition, I didn't know. Thank you.
Thank you for the question, and maybe we can discuss together. And I'm happy to work with you to get some care and see what your situation is. But
Thank you. Afam, please, we still have one more presentation, please.
You made mention of cardiac workup.
yeah.
If you can explain a little bit what that entails. And the follow-up to that is that when you look at the collection of us, from the men and the women, there's a particular set of inhibitions that we have that recruits us from accessing cardiac workup, let alone, first of all, understanding it and subjecting ourselves to it, because that lack of knowledge is what is preventing a lot of us from going to see our GP, let alone being referred to a specialist?
It's a good question. Very briefly, a workup would entail listening to the patient about their history and symptoms, number one. Hearing about what their past medical history is and what their risk factors are, number two. And then listening to them, a physical exam, just simply listen. Just listen and have a feel, okay, everything okay, or there's something funny here. And then probably cardiac workup would include some simple things like an ultrasound of the heart. Just putting a probe, take some pictures, say, okay, the heart's working pretty well. And maybe even a stress test. So those type of things, they're pretty simple tests, come with very low or no risk, and can be done pretty quickly. So maybe we can work together, you could get one, and then communicate with your friends to say, it's not so bad, you know?
Okay. Yes, quickly, one second, please.
I just have one question. How about alcohol? Can it trigger? Because I know most of us like
Alcohol?
I think trigger.
It's a good question.
No, good idea.
And I would say, so gentlemen and ladies, we're going to answer this. The last question we have the young master have us speak. So alcohol, listen, let's be reasonable, okay? We have to be healthy, but we have to enjoy our lives, okay? Canadian government says zero alcohol, no alcohol is safe. But I drink alcohol almost weekly, right? Because I enjoy the time with my friends and family. We don't have to be perfect. We're not saints. We want to, you're humans. So in excess, please, in excess, smoking alcohol, steaks, and is bad. But in moderation, it's good. So be reasonable, enjoy your life.
We want to have a very short one from Edesi and Toby, and that's it. Edesi and Toby, that's it.
Okay, well, thank you so much, Doc. I just want to add to whatever they said before, but then this is more of a remark and question to you, and more of a task for Aka. The incidence of high blood pressure among black people is very, very high. And we do not know why. Again, the high level, most of the high blood pressure among black people is traced to high sodium, oftentimes. We do not have enough research to tell us why this is so. Is there anything that you and your group know that will make us black people more at risk with high blood pressure and other risks of people? And for Aka, when I said of the task for you and your those like you will be to help us find out more about this. Because the commonest problems that we black people have is that most research do not use us, do not pertain to us, and they are done without us. So in the end, it's just using what is research on other people to use on the black people, and it doesn't work for us. So the task for you, Aka, and other young African medical upcoming professionals will be to help us get into research and see what's going on there. We as communities will be ready to help with financing this research. So it's a task for you and your group. And for those of you who are interested in the diversity, please help us, get us more into the research to help us to get to know this. Because every black person up to 40 years of age is already has it's important that
very, very insightful and important point. It's a call to action, and we don't have enough knowledge. I don't want to talk, on and on about this, but you're exactly right. And we are going to support these initiatives and others. But we need people like Aka. We need people from your community as well to work with us. It's very important.
The last question.
Yes.
Last.
Doctor, thank you so much for your presentation. It was a very big eye-opener for us. You mentioned that the surgeons you have in Canada here, the heart surgeons, mostly black right now.
There's never been one.
Yeah,
Never.
never been one.
Zero.
Okay, so one of the problems we see, even our kids here at the school, is that it's very hard to get admitted into the medical school. So I really congratulate that young man. I think that it's a very big thing. So is there any plan, any deliberate plan you guys can adopt to incorporate like communities like this? We have lots of kids in universities around in Canada, but many times they don't get admitted into the medical program. A place like UOT, being a very big and well-known institution, you guys can liaise with a community like us, and then see how you can help us and put our kids into that program. Thank you.
Thank you. So the initiatives that we're doing, we're only a small group with Aka and a few others. We do small work, but we're every year training and stimulating and enabling 30, 40 kids per year. But that's small. University of Toronto is the biggest medical school in the country. They do have initiatives to get more black students into medical school. And it's when I was medical school, 250 students, we had maybe 2 or 3, just 2 or 3. Now, entry level is about 20 to 30. So, Aka, what is it? 30?
Yeah, it's here on there.
20 to 30. So, we're getting better. We have more to do. We have much more to do, but we're getting better. So, we want to work with communities like you. You have ideas and support, and the kids, and we work together. We have to do it together.
Thank you very much. So thank you very much, Dr. Yanagawa. That was a nice one. So Aka will now do his presentation, please.
Igbo kwenu! Igbo kwenu! Kwenu! Good evening, members of the Igbo Union. Thank you so much for coming here today to learn about your heart health. You know, I'm a firm believer that each and every one of us is only as strong as our community is. And so I commend you all coming here today to learn about your heart health. It's a testament to the strength of our community. Today, I want to talk to you all about my journey to medicine and how the strength of my community allowed me to get this far. So why don't we dive right into it? Next slide. Next slide. So June 20th, 1998, I was born. I hopped out of the womb, ripped off my umbilical cord, and said, "Look out world, I'm going to be a doctor." By age 7, I had read all the medical books in the world. By age 9, I had written my medical college admissions test and passed 100th percentile. And then I had a problem. I'm only 9 years old, so I needed 9 more years to go. And so naturally, I did what any 9-year-old would do. I ate a lot of ice cream, and I watched a lot of TV. And then finally, once I was of age, I applied to medical school, and I got in, and I made my parents proud. Now, if any of you think that this story is even a little bit true, now and the word for you all. Life is not that simple. It's definitely more complicated, and there are obviously bumpy patches along the way. Next slide. Next slide. Next slide. When I was in high school, I came across a quote, and I found a lot of meaning in this quote. It's by a philosopher. He says, "To venture causes anxiety, but not to venture is to lose oneself And to venture in the highest sense is precisely to be conscious of oneself. What he means is that in life, you have to take risks. Even if it's scary, even if you're afraid, even if it gives you anxiety. Because when you take risks, that's when you begin to explore the world. And in exploring the world, that's where you discover your abilities, your talents, your passions. Next slide. So, this story starts in a small country in West Africa. It's one of the most populated countries in the world, and home to the best jollof rice. Can someone tell me what this country is?
Nigeria.
Really? Nigeria? Are you sure it's not Ghana? Okay, Nigeria. All right. Okay, Nigeria. And so, even before I was born, my paternal grandparents, they passed away from conditions like diabetes and high blood pressure back home in Nigeria. Conditions that are very manageable and even preventable here in Western society. And so it was learning about this that I began to realize that healthcare is important for our community. And I also realized that it's important for our community to be informed. And that's where the gears started turning. That's where I started to think more about healthcare and the medical field. Now, when I was 2 years old, my family immigrated from Nigeria to Canada. And as Nigerian immigrants, we didn't have a lot. But there was one thing that my parents always stressed to me. Hard work. Hard work. Hard work is the key to success. And being the oldest of 3 siblings, I knew that I had to work hard because I had to be a role model. Next slide. And so, life wasn't always easy for me. In high school, I remember coming home one day, and I had just gotten off the school bus, only to be stopped by a police officer to ask me about my ID, right in front of my house. In my classes, I was the only black male in a lot of my science classes. And to make matters even more challenging is that these science classes weren't easy. And so sometimes I would fail like tests and exams, right? And so all of these things can really knock your confidence. It can make you think that you'll never become successful. But there was one thing, thank God, that I did. And it was I reached out to my community. I reached out to my parents, my family members, my peers, my teachers. I didn't just seclude myself. I talked to people. And it was in doing this that I learned study strategies to excel in school, as well as adopted the mindset that I needed to succeed. And it paid off. I was accepted into McMaster Life Sciences in my undergrad. And even in undergrad, it wasn't very easy. First year chemistry is very difficult. For those of you who can remember back to when you're in university, those classes are very hard. But again, through perseverance and really putting myself out there and connecting myself, I was able to achieve those milestones and to be able to pass my exams. And from there, I transferred from McMaster Life Sciences to a more competitive and specialized program, McMaster Health Sciences. And there, I was able to meet other students who worked hard, who were keen, who wanted more from life. I distinctly remember meeting one student who volunteered at a cardiology clinic, and he invited me to come. And I was amazed by what I saw. At that clinic, I saw something very similar to what we're doing here today. Presentations on heart health for the community, and educating other individuals about how they can take their health into their own hands. It was at that point that I realized, this is what my paternal grandparents never received. And I thought, well, you know what? I want to provide that for other people so that they don't have to experience something similar. And so, next slide. I decided that I wanted to be a doctor, and I applied to medical school. But even getting into medical school wasn't easy. In my 3rd year I applied. I had written my medical college admissions test as a trial run, and I applied and I didn't get in. And then in my 4th year, I took the medical college admissions test again. And then I applied, and by the grace of God, I got it. And even then, I consider that an extreme blessing because there are so many talented people I know who apply 4 times, 5 times, 6 times, and they never get it. And so I'm extremely thankful that I'm able to study medicine. And so when I was in medical school, I learned that for once there was one topic that came to me a bit more naturally than the others. And that topic was anatomy. So for those of you who don't know, anatomy is the study of the human body, structures, and their function. And I really enjoyed studying this topic because it made sense to me. You know, I'm a 3-dimensional thinker. And so, in particular, I love studying the anatomy of the heart. And in studying the anatomy of the heart, I began to think about some of the diseases that present in the heart and how that can be physically cured. Next slide. And so one day I had the opportunity to shadow a cardiac surgeon who may be in this room right now. And it was in the operating room that I discovered what this career is like. And so, you know, we stood for a long time. It was grueling work, but I saw dedication. I saw passion in these healthcare professionals. And at the end of the day, when they were able to, to help an individual who had undergone a heart operation, and that person afterwards could go home to their family, I was moved. I thought, wow, this is amazing. And so I continued shadowing. I wanted to learn more. And as time went on, I got the opportunity to stitch and sew, and it was incredible. I felt engaged. I felt like I had a purpose. Next slide. Next slide. But it was only until I shadowed one cardiac surgeon, and he took my hand, and he placed it on a beating heart, that I understood what exactly was going on here. The level of trust that you have to allow someone to open you up and to operate on your most vital, vulnerable organ is incredible. And it's not just trust of that patient, but everyone that patient knows, their community. And I thought, this is what I want to do. I want to be able to help people and be able to interact with them in such a way that I can keep that trust. Next slide. So, I love motivational speeches. My favorite motivational speaker is Les Brown. And Les Brown talks about a tree in the Far East called the Chinese bamboo tree. Now, the Chinese bamboo tree has to be watered every single day for 5 years. And during that process, it's in the ground. You don't see anything. But on the last day of the 5th year, that tree grows 80 feet tall. And so, my question to all of you is, does it grow 80 feet tall in 1 day? No. Or in 5 years?
5 years.
It takes that time to discover the passion, to learn about it, to figure out who to connect with, to formulate a plan, to execute the plan. You know, there's a Igbo saying, Aka ajaja nebutu onu manu manu. This saying, what it means is, the worker must take his hands and put it in the soil and get it dirty in order to produce food that's good to eat. In other words, you have to work hard in order to succeed. Thank you very much.
Thank you very much. Thank you very much. We are running out of time, so maybe just one question from you, and then that's it. Aka is part of us, so you can always reach him if you have any questions after this. So,
I will learn a big lesson today, that there has never been any black of such a freestyle. So maybe you are going to be one. For your own assessment, understanding and research, why has there not been any black surgeon till date? Because at the hospital, you see other black surgeons, you see some other specialists. But in this field, is it because it's so hard? Or people are afraid to be surgeons? So for all research and understanding, can you educate us please?
That's a very good question, Uncle. And I do have to preface my answer with the fact that I'm still a medical student and I'm still learning. And this is a field that many very intelligent people have explored and still are trying to figure out answers to. But from my own humble opinion, I think that it's multifactorial. So there are many different things that sort of go into why, a black individual might not, become a heart surgeon, right? And so, like we've talked already in this presentation, sometimes it's barriers, right? Lack of access, it can be financial, right? For those individuals, if they come from a poorer community, perhaps. Because I've talked to a couple of my peers.
With the OSAP in Canada?
Yeah, well, a couple of my peers, put it this way. A lot of them say that their goal once they get into medical school is to finish as soon as possible, to start making the salary required to support their extended family, right? To be a heart surgeon takes a lot of years of training, and so sometimes, you have to think about what you want to prioritize. Other times it's exposure, and so it might not even cross your mind. And so that's why, like for example, Dr. Yanagawa and I, we really worked with this Next Surgeon program, mentorship program, because we just want to plant seeds in the minds of the youth to see that, hey, this is something that you can consider. This is something that you can do. And so, yeah, to answer your question, I think there are many different aspects that go into it. There's a whole field of sociology that deals with intersectionality, of kind of reading into what are the factors at play that go into why someone gets to where they are. But I think what we can do as humble individuals is to choose one of these factors and directly try and see if we can solve it. And hopefully over time, we can get to a point where we have more black individuals.